So hi, everyone. Welcome. It is a pleasure to see you as always. Um, just the deal, if anyone was tuning in and was confused about what we're doing here, is about a year ago we just started doing a lecture series, and then one led to another, and one led to another, and they're just lots of fun. And if topics are of interest, happy to do them. And this is the last evening. How are you? This is the last evening on our little anatomy series before we get back into more of our usual, the wildlife. However, like especially talking to Dorothy, if anyone had any themes in mind, these are a lot of fun. And so if there was a desire, out there for different topics, for the future, we'd probably try to work them in. So this is the last week of the anatomy one. And if you were saying, oh, all right, well, I missed the other anatomy ones. Well, I'm sorry, let me just find my own channel. I have a YouTube channel if you wanted to see any of the recording. So if you went to Dr. Jan 41, so if you typed in DRJAHN 41 at YouTube, and then you go to playlist, there's a whole bunch of playlists there, but every now and then you'll see, oh, like here's the summer lecture series where we started out with global biodiversity, and then we did some anatomy stuff. And so if you were traveling and you missed one, or you said, oh, I was really interested in the brain, I was sorry to miss that one. Et cetera, you'd be happy to go there. But this is the last week for the anatomy ones, and our fall semester is going to start off. And we had so much fun and success with a lecture series last semester, which was about 15 weeks long, kind of like on local birds. All right. Lately, I think I'm going to be throwing in more like where they go. So it's, birds of Orange County, but also like where do they spend their winter? We'll talk about, Colombia and Florida and Mexico. Where do they go, if they migrate through here? Talk about Canada, New Hampshire, et cetera. And so about the same series of topics as before. I think we'll be back in room 128 because these rooms get taken up with the lectures. You're welcome to be on Zoom. Dorothy will be posting it if anyone was impatient. And you can always reach me at walterjan@sunyorange.edu for like a schedule or the Zoom link or whatever. So next Monday, if you try to park, it'll probably be a little harder because we'll be in student mode again. But we'll be back here, but we'll be in a different theme with kind of local birds and their connections throughout the hemisphere. Did anybody have any questions before we start? And welcome everybody at home. Okay, so this is a little challenging for me because I just, I love teaching anatomy, and the nasal cavity includes, as you might guess, when I teach anatomy and physiology 1 and 2 to nurses, that's a 2-semester thing. We've tried to squeeze, a lot of it into about 5-hour-long lectures. So there's just so much cool stuff. So today is just kind of what else can we fit in. So we'll just start with some various systems. If this is of a particular interest and someone had wanted to ask questions, there's no agenda that we have to keep to. So, we can, deviate or go a little here or go there. So feel free to, to throw out questions. The goal to start off with was respiratory system, mention asthma a little bit, digestive system, mention weight gain and diabetes a little bit, urinary system maybe at the very end. And that's the plan, but we don't have to stick to it. Yeah, you had a question.
Yeah, last 2 weeks I listened from home, and whenever there's a question, unless you repeat the question, I can't hear it.
Okay.
Watching it at home.
All right, thank you. I'll try to do so that one of our attendees said that I should do a better job of remembering that when someone asks a question to repeat it here. And I apologize. I have played with settings. There's like settings if I play a musical instrument. There's like a setting for that. But then if I keep it on that setting, then people at home says it's weird to hear. So there's like all these different settings. But thank you. Thank you. All right. So let's start off with the respiratory system. So this is a smaller system, right? So we start off with a nasal cavity. Now, in this nasal cavity, right, we have, these nostrils where air comes in. So if everyone could just take a deep breath, 1, 2, 3, go. Stop. Wait, okay, you can keep breathing, but like, what are you doing? I mean, the air that's coming into your nose, I mean, no offense, just came out of their mouths. All right. And like, you guys, I think you just got here. Like, you didn't see the class who was in here before. Like, not to speak ill of them, but like, I saw people like sneezing and coughing and not covering nose. I think I saw an open sore or two. Like you're breathing their air. How do you feel about that? Well, one of the things that we have to do first off is we don't want this air to go here straight away, because as we'll see, this is the most delicate tissue you have. All right, this has germs, this has diesel, this has smoke particles. So there are these plates that stick out called conchae. All right, and the first thing that we want the air to do is to swirl around. That way, if it's cold, like in February, it'll warm up. All right, if it's dry, it'll humidify. If there's like cigarette ash or diesel particles or dust, it gets stuck in mucus. And so the nasal cavity has these plates known as conchae, which help to filter the air. So by the time it gets to your delicate lungs, it's better. There's 2 senses of smell we have, all right, in these yellow dots. This one is the one you're familiar with. This one is the one that you're not familiar with. I did speak of this before. And you know what? It's worth it. This came up with the gender topic, but why not mention it again? I think Bison brings it up. There. Now, hopefully, maybe. All right. When dogs greet each other, they greet each other a little differently than we do. All right. And if I can find this, can I find it? If I can find the video with, there we go. With these buffalo meet each other, and they like not only start sniffing each other, but they start like sampling urine and stuff like that. And you ask like, what is going on there? All right. Well, the answer is there are 2 senses of smell. And because you don't have one of them, you don't appreciate what they're doing. For mammals, smell is really important. All right, because a lot of mammals only come out at night. And so like vision is really overrated to a nocturnal mouse. I mean, so smell is their world. And there is this second sense of smell. All right. So when dogs are sniffing each other, sniffing you, they're getting information from this part. They get a wealth of information. They know male from female. They know the males. They know, is this male winning all his fights? The alpha, is he losing all his fights? Is this female in estrus or not? Is this individual sick? Is this individual related to me? All of this information. However, we higher primates, that's broken. So you have a sense of smell here and it doesn't work. So when you see somebody and you like fist bump or elbow bump or whatever, that's different from the dogs, just because this sense of smell doesn't work. There's all of this olfactory information available to you, but you don't get it. All right. So not quite as interesting as what's going on in other organisms there. All right. From the nasal cavity, air keeps going into what's called the pharynx. And we then separate it into the part behind the nasal cavity, we call the nasopharynx. The part behind the oral cavity, we call the oropharynx. And the part above the larynx, we call the laryngopharynx. So your pharynx are those 3 regions put together. As an adult, no offense, your pharynx is not very interesting. When you were a fetus, however, it looked like you were going to do gills here. All right. And then all of a sudden you look down and you're like, what am I doing? And like you had to reorganize all this. So if we were to talk about what you did with your throat when you were a fetus, crazy stuff. But as an adult, not all that exciting. We do have some tonsils here, 5 of them. And we do have a hole where air can go from your throat to your ear. And the reason we want that is if this is an eardrum, people at home, I'm just going to run to the front door and make some noise for a second. I'll be right back. Okay. So if this is the eardrum, this is the outside world, and this is your middle ear, you hear really well from this. when it vibrates. But if there's pressure on one side higher than the other, now this isn't as free to vibrate and you wouldn't hear as. So you need equal pressure on both sides of the eardrum. So the air in the outside world and the air in the middle ear, you want them to have the same pressure. The problem is if it starts to rain, the air pressure changes. If you go up in an elevator or up in the altitude, or if you go up in an airplane, this changes. If you scuba dive, this changes. So that would mean that you would only enjoy music on like rainy days, or like on 84 before you get to Port Jervis, but not in Port Jervis because it's lower in elevation. But because you have a hole in your throat, your nasopharynx, the new air can work its way up this tube, all right, to your middle ear, and that balances out air pressure on either side of your tympanum. That's great for air. However, germs can also get that way. So middle ear infections, that's where they come from. Your throat has a lot of germs in it. So not only can air make it up this tube, but germs can as well. Okay. All right. So we can go to the next place, which is called the larynx. Now, just make it big. The larynx is kind of a leftover from that crazy fetal self that you once had, because you once had like cartilage everywhere, all right? And then you decided you didn't want to have gills, so these cartilages were not supporting the gill arches. So then you like took them all and you like smushed them together to make this thing that we call the larynx that has all of these pieces. A bunch of them smushed together and became bone and became your hyoid bone, etc. All right, so your larynx is all of this cartilage from, like if you were to look at a shark, there's cartilage in its gill arches to keep the gills open. So when you thought you were going to make gills, you were putting cartilage here, and then you said, "Wait, I don't want gills." But then you had, well, I got all this cartilage, I might as well do something with it. And then you built this larynx thing. I I hate to be negative, but I'll just go there. Your life is in danger, okay? Because while you're here, you're safe, all right? But you're going to leave at some point. I'm sure you're going to get a meal, and as you try to swallow that meal, you could die. All right, because you have two things going on. You have an air tube. So here's the air tube. All right, so air can go from your nasal cavity, your pharynx, into your larynx and your trachea. But then you have a food tube, but they share parts. All right, so here in yellow, the oropharynx and the laryngopharynx, that is shared for both food and air. And if you're trying to swallow something, all right, and all of a sudden someone tells you a joke and you start to laugh or you want to do a conversation, there's the danger that this bolus of food would go into your airway, all right, where it would get stuck and potentially you could suffocate. So I'm not trying to be overly negative, but the next time you swallow food at a meal, you could die. Okay. People at home, no one here is overly upset because apparently they read ahead, right? And they know that one of the cartilages in the larynx is what's called this epiglottis. And the epiglottis will close when we swallow. So when we're not swallowing food, it's open and air can go down there. But then when we swallow, then it closes and food cannot go into our airway and then goes into our foodway instead. So if we were to look at a cat, for example, all right, so here's the airway. Air goes this way down the trachea and into the lungs, but behind it is the foodway. All right, so you have two different passageways. One's for air and one is for food. So this is the airway. Behind it is the foodway. And what you don't want is for a bolus of food to end up getting stuck in your airway. So there is this little flexible piece of cartilage. You have different kinds of cartilage. One is really flexible. It's called elastic cartilage. You have it in your ear and you have it here. Those are the only two places you have this really flexible cartilage. And when you swallow, this closes over the opening to your airway so that food doesn't go into your larynx. Okay, so hiccups are odd. I don't think, I think that's more, a lot of hiccups are triggered right where the trachea splits into the first bronchi called the carina, right? But I think there's a couple of things. And so that participates in the hiccup because stuff is coming, up, but I don't think that's a cause. So, last thing in your trachea, you got all these little pieces of cartilage. But there's just this little, tiny thing that you take advantage of. And I'm just going to demonstrate it real quick here. If I were to, if anyone's really sensitive to sound, you might want to, I'm just going to take a lungs full of air and let it all out. Okay. So as you see, it doesn't have to make sound, or my airways are wide. All right. It doesn't have to make all that noise. But if I do this, if I put something in front of my mouth, all right, as the air left, it made this vibrate. And now there's vibrations and air molecules that hit your eardrum vibrates. And now that's what you detect as sound. So just air going somewhere doesn't make sound, but vibrations in the air do. And so in our larynx, we have these little tiny cartilages which have vocal cords attached on one side and muscles on the other. And if you pull on the muscles, then air can only leave if it makes this vocal cord vibrate. And that's how you make sound. You can pull on these muscles and change your pitch. So if you're at a karaoke thing and you want to hit a high note, you pull tighter, right? Just the way if you have a piano or you have a guitar, you tighten the string, all right? And that makes it higher. If you loosen it, that will make it lower. And if you look at certain instruments like a piano or a bass, it's the loose, thick chords which make the low sounds. And it's the high, tight ones which make the higher pitch sounds. So you do the same thing. You'll pull this tight to make a high pitch sound, and you'll loosen it to make a low pitch sound. When boys and girls are growing up, they have similar vocal repertoires. But then puberty hits. And while both men and women both make estrogen and testosterone, typically there's a difference in ratio. And androgens like testosterone will cause these to lengthen and thicken. So like if you were to look at a piano or a guitar or a bass, like there's a difference that the longer, thicker strings make the sound. Okay, I'm sorry. I'm just going to mute someone who has some background stuff going on. Where am I? I lost myself. Okay. And so if you make these longer and thicker, it changes the pitch. All right. Now, this is a quick overview, but I'm sorry, I just have to mention this one. You are human. Being human is special. All right. So you're different from like the non-humans. And if you were to ask why, I know it's in here somewhere. If you were to ask why am I different from the non-humans, what is being human all about? Like if I were to list the parts of my body which are special, that make me human. All right. So just we have time for like 2 seconds. You have 2 seconds to think of the parts of the body that make you human. Okay. Did anyone think of the position of your hyoid bone or the sphenoidal section of your pharynx? Good. Good. Well, I would argue that even though that's on nobody's list, they should be close to the top. And the reason I would argue that is there are primates that are capable of language. They can do sign language, but they can't talk. All right. Because it turns out that if you want to make the sounds that human speech is composed of, this area has to have the right shape. Like if you think musical instruments, like, someone changes this guitar for that guitar, it has a different shape, so it sounds different. All right, so all of these different shapes are helping to produce the sounds here. Well, apes just can't make our sounds because this doesn't have the right shape. The hyoid had to change its position, and the mouth, which used to stick out to here, had to get shorter, which is horrible for orthodontics. I mean, everyone now needs braces because you have less room for teeth, but the same number of teeth. All right, we actually choke on our food a little bit more because we changed the hyoid, but this enabled human speech. And if we were to list what makes us different from the non-humans, speech is one of the big ones. And even though like this wasn't high on your list, little tweaks in this area ended up having profound impact for the human condition. So I like to mention. All right, we go on. And you have two tubes. All right, you have an air tube and a food tube. And if you were to even let me just look at a picture real quick. So if you were to say, let's look at a throat. You say, oh yeah, there's two tubes. So there's an airway, the trachea, and there's a foodway, the esophagus. All right, so the air is going in the airway. And along this, we make mucus at things called goblet cells. Now, this is actually the colon, all right, but it's such a pretty slide of goblet cells, so I can't like not use it. They stain the goblet and the mucus it makes blue. So goblet cells look like the top of a goblet, like a wine glass, and they make mucus, and the protein of mucus mucin is stained here. So we have them in lots of places in our body. We have it in our throat, and so that's what they look like. And the mucus is trapping dirt, debris, things like that. And once it does, we have cilia. Now that's cilia in a one-celled organism, right? But we have cilia that looks just the same. So our trachea is lined by cilia. So mucus traps all this gunk, like cigarette ash, dust that's in the air, Canadian wildfire ash, just, all this stuff. And then we sweep it away from our lungs. Our lungs are delicate. And we sweep it towards our stomach. So right now you are swallowing mucus that's full of gunk. And if that's not appealing to you, the alternative is bringing mucus full of gunk into the most delicate tissue that you have in your lungs. So a big bag of acid is by far a better place to bring all of this. All right. So the air is getting cleaner as it goes down the trachea. The trachea has cartilage in it, which helps it stay open. And then it splits to form the bronchi, which go into the lungs. And then from there, we get smaller and smaller and smaller in our respiratory passages. It's one thing to talk about the respiratory passageways, but just a shout out to the blood as well. If you remember the heart lecture, we have two halves of the heart, a right half and a left half. The left half of the heart, when the left ventricle contracts, it sends blood to your brain, to your arm, to your leg, to your digestive system, like pretty much all your body. Your right ventricle, when it contracts, it sends blood one place, the lungs. Your lungs get as much blood as the rest of your body combined, because the two ventricles, they pump the same amount of blood, about 70 milliliters per heartbeat. So the amount of blood that the left ventricle sends to the entire body is the same amount that the right ventricle pumps to the lungs. So you have an enormous amount of blood going to your lungs. So these are the blood vessels of a cat, cat's lungs. There's an incredible number of blood vessels accompanying these respiratory passageways as they get smaller and smaller. Okay. Now, there are different passageways. I've got more videos, but just bronchi have a little cartilage, then bronchioles don't. But that starts to matter with asthma because the bigger passageways have cartilage. So the cartilage is going to keep it open, but the smaller ones don't have cartilage. Now, most people, all right, have an airway that look like this. So here's the airway. It's got some muscle in it. And let's say you go out on a cold day, or let's say there's like smoke in the air. All right. Well, you want to protect your lungs. So what we all would do is take this and squeeze a little bit so that less of this smoky air or less of this cold air would hit my delicate lungs. So that is normal. Everyone does that. But if you, excuse me, if you chronically inflame your lungs, you change it. All right. If you're constantly irritating a tissue, it then remodels itself and looks different. And now it's thicker. It makes more mucus. It's got more muscle. And now someone with a remodeled lung, if they get hit with cold air or smoky air or something that has an allergen or whatever, now when their muscle squeezes, it's big, powerful, thick muscle. It squeezes really hard. This can completely close the airway off. And now the person has trouble breathing. All right, so whether or not there's cartilage like in the bronchi versus no cartilage in the bronchioles matters very much to people who have asthma. Our lungs have separate lobes, all right? And they're like in this bag that has a slight negative pressure to it. All right. So the pressure in here in the orange is just a little bit less than outside air pressure. So if you go to a party, I don't want to speak for your parties, but like if you end up being stabbed by the end of the night, that's a problem because now real air with the regular air pressure is getting in the orange space that should have a slightly negative pressure, and that will collapse a lung. All right. So Just like the heart had a pericardium around it, the lungs have this orange bag called a pleura, the pleural membranes around that. Okay. Now, as the lungs got smaller and smaller, yeah, so here's my bronchi and bronchioles with the cartilage. As the lungs get smaller and smaller, they end up at what's called an air sac. And this is the part that matters. A lung is a bag of these. So if you, like, how does a lung work? Let's just talk about how this works, because a lung is 150 million of these, all right? So here we have really thin cells. I'll show you the actual microscope images in just a second. We have really thin cells, and here's an air sac, an alveolus, all right? But then next to it are capillaries from the blood, really thin blood tubes. Now note that they don't mix. Blood never goes in the air bag and vice versa. But they get so close to each other. And because this lining is really thin and that lining is really thin, it's thin enough to actually then let gases go back and forth. So our lungs are just these air sacs called alveoli that have really thin walls. And not only do the airways have thin walls, but the capillaries, the blood has thin walls. So here's the lining of a blood vessel, also really thin. So here's an air sac, here's a blood capillary. And as I close in on it, all right, the space between the air sac where the air is and the capillary where the blood is, that's like just a fraction of a red blood cell's diameter. That's really thin. All right, so this is the most delicate tissue that you have. And it's so thin that oxygen can go from the air sac into the blood, and carbon dioxide can go from the blood into the air sac. And I'm sorry, I'm just picking up a little bit. Just going to mute anyone who's not, because I'm just picking up a little bit of background. There are other things like we keep this moist, and water is good, but water is not great, all right? Because water is just, it just pulls a little too much, and that would be a problem for you, but it could be deadly for infants, especially premature infants. Several tens of thousands of infants die of what's called respiratory distress syndrome, where their lungs collapse. And so we need other cells there to make something to put in the water so that it doesn't have the surface tension that water does. And this is the main reason that premature infants have to be watched very carefully, because they might not be making enough of that. The last thing on the respiratory system, before I mention asthma quickly, is I just want to say something. All right, if this causes an emotional reaction in you, this is a free space, feel free to express your emotions. You are not a salamander, which I'm sure has like profound implications that you'll be thinking. But one of the big ones is, if you look at the salamander, it has to breathe by its throat muscles, like sucking air in and spitting it out. That's exhausting. It doesn't work for the salamander. Look, it's stuck in the middle of the road. There's some biology teacher with a camera and a flashlight right in its face. It would love to run away. Now, if that's not working for the salamander, imagine how much less it would work for you with your big brain, your warm blood, et cetera. So that's not a good way to breathe. There is another way, all right? And the other way is to involve a law of physics, where we realize that there's an inverse relationship between volume and pressure. So in other words, you go to a kid's birthday party, you get a balloon. You sit on the balloon, it pops. Why? Because when you sit on a balloon, you make the volume go down. You're making it smaller. But when the volume goes down, the pressure goes up and it explodes. All right. And then you do things that the salamander doesn't. One, you have ribs, all right, that go to your breastbone. That was an invention of the first reptiles. They said, hey, let's not just have these little stubby bones. Let's have them come all the way around and touch here. And so now the muscles which move the ribs, so the next time that you eat ribs, all right, that's what you're eating, the muscles between the ribs. Now the muscles between the ribs, when they move, they can change the volume of the thorax, all right? So there's that. And then we mammals, we decided, just here's a mammal thing. We wanted to get beer guts. All right, so reptiles don't get beer guts, amphibians don't get beer, mammals get beer guts. Our guts hang out. All right, why do we do that? Well, let's just say you're at home and you're like, oh, I've been staying in shape, and you're like, no one else is around, so you say like, all right, I'm going to stand in front of the mirror. My guts hang out, suck them in. Let my guts hang out, suck them in. My guts, and I'm like, oh, I meant to go jogging more. All right, but then all of a sudden you realize something. My ribs aren't moving. and I'm breathing just fine. So that's something that mammals do. In addition to, making our chest bigger, we can also then just have our guts hang out and then our lungs get longer this way. All right. So when you inhale, that's what you do. You're not going to suck air in. You change the volume of your chest. If you make your chest bigger, because the muscles between the ribs are making your chest bigger this way, and your diaphragm is making your lungs longer this way. If you make your chest bigger and you open your mouth, air comes in for free. All right. And then if you make your chest small and you open your mouth, air goes out for free. So unlike the salamander sucking air in and spitting air out, we just change how big our chest is and the air goes up. So one little aside is asthma. So if you, were here when we talked a little about heart disease, the big lesson for heart disease was it's complicated. Like if someone says, "Oh, it's your cholesterol," yeah, but it's like a whole list of other things too. Asthma. Sorry, that was the wrong button. Asthma is the same way. All right. So asthma is complicated, and I just want to introduce a couple of thoughts on that and then move to the next system. It's important. The World Health Organization estimates that asthma affects hundreds of millions of people, causing hundreds of thousands of deaths. And I want to just say this: we breathe really good air. All right. Like I'm sure it could be better. I'm sure there are days where there's ozone, but since the 1970s, there have been clean air acts that both parties have been supporting, et cetera. That really makes a difference. And if you were to live somewhere else, you would really know the difference. I had a nephew in Paraguay who died of asthma at age in his early 20s, and just we don't have the protections, in other places where we are here. One of the slides I show, take me too long to find it, but it was from Paraguay. It's not this way anymore. But it was at a gas station where you see, this was like, I think in the 1990s, but it was like you could have like, the common gas, like the cheap economy gas. But then there was like the super gas. But underneath super, it said sin plomo. Does anyone know what sin plomo means? Yeah, unleaded, without lead. Very good, without lead. And then you're thinking, wait, gas doesn't have lead in it. It did throughout much of the world until very recently. So we banned lead in gas in the 1970s. A lot of the rest of the world took much longer to do that. And just, a point, we breathe really good air, and because we value that, we passed laws to make it clear. So while asthma is bad in the United States, there are just places, I don't know if you remember, there was an Olympics not too long ago where there were athletes who weren't going because they thought that just like spending a couple of weeks in the country where the Olympics was being held would hurt them. So anyway, asthma is a major health concern, but it's complicated. And if I were to try to sum up its complications in like 90 seconds, why would a bronchiole become thick? Why would it remodel itself after chronic inflammation? Well, now all of a sudden, you're talking about both environment, all right, like air pollution and smoking, et cetera. But now you're also talking about the immune system. Asthma is an inflammatory disorder, and the immune system is the second most complicated part of your body. Your brain is number one, immune system number two. And so if you want to talk about asthma, you're like, oh, in this person, eosinophils are going to their lungs, which is giving them a risk of asthma because eosinophils shouldn't be in your lungs. All right. And then there's, these because I grew up on a farm, I grew up exposed to germs. My T cells matured this way, but because you grew up in your suburb, you're going to do more inflammation. Where I do more germ fighting with my immune system, you do more inflammation. All those little bags leaving these cells are causing inflammation. So you in your suburb, you're going to be more prone to get asthma than I was in growing up on the farm. And so I have a playlist that just goes through all of these different things. So there's an environment. So there's certainly, air pollution. Some of that's indoor. All right. So like, smoking indoor, there's that. And then the complicated thing is there's genes and there's environment, but then it's which combination that you have. So if I'm allergic to cat dander, will I get asthma? Not if I don't have a cat. All right. So that, just my genetic predisposition doesn't mean I'm going to get asthma. All right. But it's, the environment along with it. Am I exposed to air pollution? Am I going to get asthma? Well, this is just an example I like to use. There's one specific gene that Caucasians often lack, that they have a broken gene. All right. So if you have a broken gene and you're breathing good air, you're probably fine. If you're breathing a little bit of air pollution, but you have a working gene, you're probably fine. It's only when you have a bad gene and a bad environment that would now cause chronic inflammation. So if you wanted to understand someone's asthma risk, there's a bunch of environmental factors, there's a bunch of genes involved, and now it's which combination that you have. For adults, a lot of adults get asthma on their at their workplace. So a lot of adults, I mean, they're painting or they're house painters, there's all of these, they're working in an auto shop where there's all of these solvents, or they're hairdressers and they're constantly exposed to these. They're in healthcare and they're always exposed to latex. All right. So there's all of these different things involved. So asthma is complicated, as was heart disease. But we move on into our next system, unless anyone had any questions. So just highlights of digestive system and digestion, and then maybe, a couple of things about weight gain and the like. So in our digestive system, we have a tube through which food passes. All right. So when you eat food, it goes into your mouth, your pharynx, your esophagus, your stomach, your small intestine, your large intestine. That is the tube through which it travels. That's what's called your GI tract. But wait, there's more. There's more, even though food doesn't go through this next set. This next set, like your salivary glands, the liver, the pancreas, the gallbladder, food doesn't go through them. They're not part of the tube, but they're releasing things into the tube which help your digestion. So your digestive system is then two things: a GI tract and then accessory structures which accompany the epithelium, which lines. Now, the nature of different parts of this GI tract is going to vary. Like, no offense, but like you eat like granola bars, and like, just think about that. Think like the sharp edges. All right. Think if you're a cell in your esophagus and you got like granola going by. All right. So that's rough. You don't want to be like bleeding every time you eat granola. All right. So in certain parts of our GI tract, we're going to have all like a thick layer for protection. But then in other places like your small intestine, you don't want protection. You want like stuff to really move easily from your the space in the middle of the small intestine called the lumen into your bloodstream. All right. So what we do at the types of tissue that we have vary because certain parts have different strategies. Your digestive tract has its own nervous system. We give it a name, the ENS. No one ever mentions it, at the enteric nervous system. It has as many neurons as the spinal cord. Let me say that again. All right, we make a big deal out of the spinal cord, but like your small intestine, your esophagus, your stomach has its own neurons, has as many neurons as the spinal cord does. And in other words, your digestive system kind of runs itself. All right, your brain can say, hey, it's an emergency, stop digesting your food for a while. Like, your brain has some input. But apart from that, your brain has no idea where your dinner is. All right, it's just the neurons of your digestive tract which are pushing the food along. All right, and then this is mostly a type of muscle which we don't have voluntary control over, called smooth muscle. All right, so a couple of weeks ago we said, if you think of a body part and move it, then you have skeletal muscle there. Otherwise, it's either cardiac muscle if it's in the heart, or it's smooth muscle if it's everywhere else. And smooth muscle is great, but you're not aware of it, and it's not under voluntary control. All right, so you've got neurons which are pushing your food down your esophagus into your stomach, etc. But we aren't aware of it, and we don't voluntarily control it. So we're special, all right? And just, I don't have time to go into how special you are. But first of all, like, there's just so much we take for granted. And so I always start with this. According to the United Nations, the last numbers I read were about 30,000 people will die today of either hunger or a hunger-related disease. And I make that point because our bodies are expensive. You're 100 degrees every second of the day in February. That's not cheap. You've got like one of the biggest and most complex brains we know of. That's not cheap. All right. You're not dragging your belly on the ground like a lizard. You're upright. You are not cheap. It takes energy to run you. And then things you take for granted, we shouldn't. I mean, this is what pays for that. So, for example, if I were to say you have a mouth and a nose, amphibians don't. All right. Reptiles don't. Like, if we were to look at somewhere, I think I already passed. Yeah. Like, here's a frog. When a frog breathes in air, where does it come out? Here. Those are the internal nostril things. So this whole, that's neither the mouth nor the nasal cavity. That's both. This is for both food and air. So if you're a frog, you have to make a choice. Do I want to breathe right now? Do I want to eat? If you're a turtle, you got one space. This has both food and air. All right. Do you want to breathe or do you want to eat? All right. Now, turtles and frogs, they're not expensive. We mammals are. Like, if these cows had to stop chewing in order to breathe, you couldn't have a cow. All right. So we're just really expensive. So we have a mouth and a nose. All right. That makes us mammals special. We take it for granted. We chew our food. Most things don't. Most things just kind of do chomp, chomp, and swallow. All right. But we know that we are so expensive. All right. That we have to get every single calorie out of our food. If we just chomp, chomp, and swallow, when we flush the toilet, we would be like losing calories. All right. We would want to keep us alive. All right. So most things don't have different kinds of teeth, and most things don't chew. All right. Somewhere I have like, yeah, if you look at this great blue heron, what's in its stomach? A catfish. All right. Like the whole fish. All right. Whereas you keep food in your mouth and you process it a little bit. Plus, that like mammals, look at our teeth. We have different kinds. We have incisors, canines, premolars, molars. They've got matching surfaces. All right. Once again, it is insanely expensive to run a mammal. All right. So if you're a zoo, you can keep 40 big crocodiles on the food that feeds one tiger. All right. So mammals are expensive. And we humans, with our big brains, so much more so. All right, so every little thing about your teeth, your mouth, we take it for granted. Oh, I chew my food, doesn't everything? No, that's actually a special thing. We have a mouth and a nose. Not everything does. Once again, this just allows us to power our really expensive bodies. And just once again, tens of thousands of people won't get enough calories to get them through the day. All right, it's that expensive to run a human body. Okay. When we swallow a bolus of food, it hits this big mixing bag. All right. So that like maybe it's mushed up French fries by the time it hits the stomach. All right. But by the time it leaves the stomach, it's juice. So the stomach's job is to churn this all up so that it's kind of like a juice now, and all of those foodstuffs are accessible. And we have like little doors here, like just like there's a space in the hallway, there's a space in this room, but I can shut the door if I want. All right, and I can make this room special that they can't come in just now. Here, like this is one space, but there's a door here called a sphincter, an esophageal sphincter, a pyloric sphincter. So nothing comes into the stomach unless that opens. All right, nothing leaves the stomach unless that opens. Now, every now and then, like we have issues, like chocolate will make that like open a little bit, as will alcohol, as will spicy food. And now, stomach acid may start to give us acid reflux here. That's not good because A, it hurts. That sucks. But two, we don't want cells to divide more than they have to. All right. So I think the most obvious example is, if you don't mind, I'm just going to mention breast tissue comparing men and women. Same types of cells. Breast cancer can happen in men, but very rare. All right. Unfortunately, far more common in women. Why? Couple reasons. The major one is every month there are signals in women for the cells to divide. And every time cells divide, they make mistakes. We have that much DNA that when a cell divides, there's a new mutation that you didn't have before. It just happens. And if cells are dividing again and again and again, that's just a mutation, a mutation, a mutation. It keeps building up. So if you're going to irritate this and kill these cells with stomach acid, all right, you have to replace them. That's just all this extra cell division that you don't need, now increasing your risk of esophageal cancer. All right, so it hurts. We don't like acid reflux, but we don't want cells to divide more often than they should. Some people think they're having a heart attack if this doesn't open and food gets stuck there. All right, but It turns out while they did have chest pain, it wasn't a heart attack. It was just food stuck above the esophageal sphincter. Now, because we close these off and we keep them separate, we can have special things going on in each one. So the stomach is acid. All right. The acid is great because it like kills all these microbes. I don't know if you know this, but when you drink milk that you just bought in the store, it could have like 10,000 living organisms per milliliter. All right. And be sold in the store. If you eat a hamburger that's a little rare inside, if it just you bought it in the store, there could be 1,000,000 living things in a gram. All right. Should you care? Nah. First place your food's going to go is a big bag of acid. All right. That'll kill almost everything. All right. So that acid has a number of roles. By the time we send it on, this is where we start seeing some of those accessory structures like the pancreas. Your food's not going to go through your pancreas, but it makes some of the enzymes which are going to rip up your food. All right, so your pancreas is making enzymes. They go to this tube. They will then go into the small intestine. All right. The liver. All right, so for those of you who are here early, you know the liver inspires song. We could spend hours. The liver, I used to give it in my lectures. I apologize. I need to keep up with stuff better than I do. And my notes were like, the liver has more than 200 functions. Well, I just looked it up. Again, the liver has over 500 functions. So like in the past, like 8 years since I looked up that fact, there's 300 more things the liver does that we didn't know about like 8 years ago. Right? That's crazy. We now know all of these hormones it makes. So if you list the places of your body that makes hormones, the liver makes a bunch. Your liver has important roles in the immune system. Anyway, so just 2 quick examples of the liver, which is your second largest organ after your skin. Your skin is your largest organ, liver is first. Let me just kind of weed our way into the liver's importance here. So if this is the vein that's going back to your heart, and here are all your digestive organs. When you digest a meal, all right, whatever you ate gets digested and it goes into the blood, it goes in these veins, and here's the vein that goes back to your heart. So you'd think, I got sugar, I got protein, that I just digested, and I want to send it to my brain. There's the vein that goes back to my heart. So all of these veins that have the remains of your last meal should go here, right? No, actually. All of these veins go into this purple one that goes to one place only, the liver. The liver gets your food before any other part of your body does. Why? Well, we could go on like those hundreds of functions. A lot of them are food things. So your liver does a whole bunch of things to fat. I'm sorry, this is the sugar ones. I'd be happy to go through them, but we're not going. So your liver does a whole bunch of fat things. Your liver does a sugar thing. Your liver does a whole bunch of fat things. All right. You eat horribly. That's no offense, but like you drink coffee. There are carcinogens there. You cook your meat, and the charred ends have carcinogens. There's carcinogens in broccoli. Are you scared? Nah, because that's one of your liver's jobs, to break these things down, to bind heavy metals, to break down alcohol. Your liver protects you from what you've eaten, which is why you send food there first. All right. So your liver has hundreds of functions. When you eat a meal, goes to the liver first, and the liver does, it's hundreds of stuff. Here's just one quick example to hammer the point home. Let's say a woman has strep throat. She has an infection in her throat, and she wants to take an antibiotic. Well, before giving her the antibiotic, the doctor should ask her questions like, are you allergic to antibiotics? Are you pregnant or breastfeeding? There's another good one to throw in your top 3 or 4. Anyone? If you had a woman patient, you were about to give an antibiotic for strep throat, what would you ask her? I'm sorry? Sorry? Pregnant? That was one we'd ask. Are you on birth control? And if you're thinking, wait, throat, birth control, I'm not following. So antibiotics mean what they say. They're antibiotics, they're poison. All right, you're trying to kill the bacteria, but they're just poisonous. So your liver, when you take an antibiotic, says, look at these poisons. I have to now start making enzymes that rip up all of these potentially poisonous things. If a woman is also on birth control, she's taking hormones from an external source, thinking that the levels of progesterone and estrogen will be up here. But once her liver starts making all these enzymes, they start breaking down these as well. Now her hormones are down here, all right? And now she can get pregnant, even though she's on birth control, because she's not really on birth control, her liver digested it. Just an illustration of why you have to say, what would the liver do under these circumstances? Because it has 500 different things that it's doing. One of the other things it's doing is it's making bile to help in our digestion of fat. And this then brings in the gallbladder. So your liver makes bile that'll go through this bile duct into that bile duct into your small intestine. And that's really good if you're eating a big bowl of fatty ice cream. But you're not always eating a big bowl of fatty ice cream. So when you're not eating a big bowl of fatty ice cream, this little door closes and the bile backs up, right, into this little bag called your gallbladder. The gallbladder will then take that bile and concentrate it, all right, so that when you do eat that big bowl of fatty ice cream, now you have a lot of concentrated bile. So in addition to the liver's bile coming down the tube, now you have concentrated bile coming here. Right. The problem is sometimes you can concentrate things so much that they become a solid and you can have gallstones, right? So, they would have to be broken up, whether by sound waves or maybe have the gallbladder removed if you concentrated bile so much that it became solid. If you were wondering what bile does, so once again, just get back. We are very lucky in how available food is. I mean, if a lot of us are worried today, just like it's me, like, ooh, like that's probably too many calories. I won't eat that, or like I'll like, but like that's not the situation that billions of people on our planet are in. Like, ooh, I'm, tempted by too many calories. How do I avoid them? So bile helps us here because if this is fat, these are calories. This could save your life today. This could be what powers your body. But you can't digest a big gob of fat if it's floating through the watery small intestine. So what bile does is it takes a big gob of fat and it breaks it into all these little droplets of fat that now all of your enzymes can access. So you're not going to flush calories down the toilet because it wasn't this big gob of fat and you couldn't get at the middle. You broke it up into lots of little droplets that now you could access. So that's what bile does. Right. So the small intestine has all of these things emptying into it, the liver, gallbladder, and pancreas to help its digestion. And then your small intestine just, it has a goal. It wants to touch your food, period. Because that's where the digestion happens. It's going to finish ripping up, your food into little pieces and absorb the good stuff at where you touch the food. So if you were to look at your small intestine, a second, all right, we see that it's got these ridges. So it'll go up, it'll go down, it'll go up, it'll go down. That increases its surface area and how much touching there is. Oh, but wait, let's look closer. Look at the cells. It's not flat. Look, it goes up, it goes down, it goes up, it goes down, it goes up, it goes down, it goes up and goes down. Now you have all of these extra cells touching your food. But wait, there's more. If you were to look on the surface of the cells, so we were to look really close, all right? They have little ridges. Each cell has little ridges called microvilli. The other ones were called villi. So we have so much surface area for touching your food because of those folds, the villi and the microvilli. It is here that your food is being broken down. It's here that the good stuff goes into your blood, which I'll mention again in just a second. Once stuff leaves your small intestine, you're kind of done, all right, or mostly done. And so then stuff hits the large intestine. So just like the stomach has an entrance and an exit, the small intestine has an exit. It ends here at the large intestine. There's a little place called a cecum. It's kind of like a blind pouch. All right, and that's just kind of weird. But like if you were to look, I forget, I think there's a monkey. Here's the small intestine coming in here. Here's like a little blind pouch called the cecum. Right. And one of the things that it would do is, let's say you have diarrhea and you flush your, large intestine. Now you don't have good microbes to replace, the stuff that you lost. But your cecum can like, store a little bit, like have a reservoir, from which you can repopulate your large intestine if you want. We do have an appendix there. If that were to become inflamed and ruptured, um, I was going to get to this in a second, but I'm here now. Uh, by dry weight, like almost a third of your large intestine is bacteria. Like bacteria, just like let's say you look in the mirror and you say like, oh, what a good looking bunch of human cells, and you're not wrong. But actually, the number of bacterial cells that you're looking at in the mirror outnumber the human cells. So this package that you call you, there are more bacterial cells there than human cells. Now they're smaller, and most of them live here in the large intestine. We like them, all right? Like we like the good ones. We're just really starting to understand how much we get out of them. We call them our microbiome, and we try to control what ones are there. But if this were to rupture your appendix, you've got a lot of bacteria here, trillions per gram. So if that's leaking out into your pelvic cavity, that can easily cause a systemic infection, which is life-threatening. All right, so having this appendix rupture is a problem, which is scary because any of us could say you wake up and you're thinking, I feel great. All right, a couple hours later, you're like, feel a little off, like my stomach hurts a little. And then a couple hours later, you're like, yeah, I'm feeling worse. And a couple hours, you're in the hospital. All right. And like as someone who was a scout leader, you're like, you take kids camping, like any person on any day could now, you have to be within hospital range, in case someone's appendix burst. Like it's unlikely, but it's possible. I was actually hiking with someone and they were having a bad day and it turned out on the way home, they had to hit the hospital. So that's a scary thing, this rupturing and, leaking trillions of bacteria in our pelvic cavity could happen to anyone at any time. One final video on the digestive system, which just I think tries to sum it all up, is in theory, I'm sorry, got all these videos. I just want the one magic one that sums it all up. There we go. Okay. In theory, you don't make good food choices. In that, like, you eat starch. Starch is half the American diet. It's too big. It's a plant molecule. You don't use plant molecules, and it's too darn big. And then you eat proteins. You eat chicken protein. Where in your body can you put chicken protein? Nowhere. Where can you put beef protein? Nowhere. You eat corn oil, all right, and olive oil. You don't use those. Like, so these things that you've eaten, too big to move, all right, can't fit in the blood. Two, you don't use any of those. So, on face value, you've made bad choices. But if you say, ooh, but if I tore it up into little pieces, it's like if I like had a Lego set and I made like a Death Star and I said, here, my gift to you. You're like, I don't want a Death Star. But if you said, ooh, let me break up all the Legos, now I can make whatever I want out of the Lego pieces, not the Death Star that he made. So the same way, if we just rip up the starch and the chicken proteins and the corn oil, now we don't have these molecules from other animals. Now we have the pieces that we can then either use for energy or we can reassemble to make human hair or human antibodies or human hemoglobin. All right. So it's the Lego pieces. Once we break them up into the little sugars, the amino acids, the fatty acids, as opposed to the big molecules, now we can do whatever we want with them. So that's essentially what digestion is all about. You want to rip the big molecules that you eat up into little tiny pieces, put them into your bloodstream, and now you can either break them down for energy or you can use them to build molecules of your choice rather than the chicken's choice or whatever. So with this, two very quick things, and then maybe we'll mention that the urinary system exists. There are different types of diabetes. Type 1 diabetes is an autoimmune disease. And so once again, the immune system is so complex. So if you wanted to say like, what's going on with type 1 diabetes? It's an immune problem. Your immune system decided to attack your cells that made insulin because they thought they were not your cells. They thought they were foreign. And now you don't have cells that make insulin anymore because you killed them all. All right. And that's a problem. All right, so what causes that? And what makes one vulnerable? What genes, what environmental factors? Well, you start getting into crazy complicated immune stuff. Like, so to be honest, sometimes I make videos for my students. Sometimes I make videos for myself because after I read like a big complicated paper, like I understand it for like 30 seconds and I'm like, let me make a video for myself for later. Because like the next time I'm like, what was going on there? Like I'll watch my own video. I'm like, all right, yeah, I remember that now. Crazy complicated there. One other thing that we should mention is weight gain. Um, Now, what I'm about to say was true before coronavirus. Coronavirus kind of threw off some statistics. But in general, longevity is going down, all right? And the main reason is weight gain. Now, that seems odd because if you look at like the major causes of mortality, it's like heart disease, it's like asthma, it's like cancer, like weight gain isn't there. Oh, but weight gain will make your risk of heart disease worse. Weight gain will definitely make your risk of asthma worse. Once again, you think it's a lung thing. Yeah, but like if you were to ask who is hospitalized right now for their asthma, lots of people can get asthma, all right? But who's hospitalized for it? The vast majority are overweight. All right, so there's a connection between weight gain and asthma. There are a lot of cancers whose rate goes up with weight gain. All right, so weight gain is incredibly important and it's a major effect on health. And one of the things we learn, adipose makes hormones that talk to the rest of the body. So if you gain 10 pounds or you lose 10 pounds, that just doesn't affect your gut or wherever. That affects all the tissues of your body because that fat was talking to everybody. All right. So it affects the reproductive system. All right. Leptin affects risk of cancer. Leptin affects heart disease risk, and there are other hormones as well. All right. So what are your white blood cells doing? Well, your fat cells are talking to your white blood cells and changing how they act, which might make you now more vulnerable to asthma and other things. So I have weight gain is really involved. So let me just show you two more quick videos. One of them is, here's something that we didn't know. Cilia are these little hairs that wait. All right, a couple places like your throat have lots of them. The oviduct has lots of them. But almost every one cell of your body has one. So most cells of your body have a cilium. It's kind of like a compass needle. And it turns out there are all of these genetic diseases where you're screwing up a gene that's made on the cilium. And a lot of them will make you gain weight. All right. So this is a fairly new field of understanding for us. Like, oh, this primary cilium we didn't really appreciate. Turns out it's important. Also, involved in a lot of weight gain for weird reasons. We go into so many other reasons, so many other things. Just one last thing about fat. All right. What would be the effect of gaining fat? Well, a big question is, well, where did you gain it? Did you gain it under your skin? All right, because that's not great, but it's not so bad. All right, now we do have to follow up, like, where did you gain it? So like in humans, for example, we talk about, kind of being apple-shaped or being pear-shaped or whatever. Like if I were to gain like adipose and put it here on my thighs, not great, but not bad. If I were to put it here on my abdomen, that's a little worse, right? So where adipose is in your body has slightly different impacts on health. But if we were to go inside here, like, so this is inside the abdominal cavity, there should not be that much adipose there in these organs and around these organs. That's what's called visceral fat. That's worse, all right? So that's making hormones, like one's called visstatin, all right, that other ones aren't making. So like if we're gaining weight, where are we gaining it? That actually matters. So once again, teaching biology, like I'm fascinated by like, ooh, look at all of the stuff. It's not just, like with heart disease, it's your cholesterol, or asthma, do you smoke? Or like, there's just so much biology going on. So if you're interested, there's all of these directions you could take. The very last one that I could at least mention exists
glycine
is if you digest proteins for dinner, okay? Proteins get broken down in what are called amino acids. And if you're going to use an amino acid for energy, all right, you have to take this little group off called the amino group. So amino acids make up proteins. They're called amino acids because they have an acid group and an amino group. And if you take the amino group off, which you would have to if you want to get that energy out of that. So let me take 2 aminos off of 2 amino acids. If I throw a hydrogen on that, I've just made something, I've made ammonia. So you are filling, potentially, your bloodstream with ammonia just because you're digesting your dinner. Now, that will kill you. All right. Now, your liver helps you out, as you might guess, with its 500 functions. Your liver says, ooh, let me take the ammonia and let me stick it to the central little piece so this becomes urea. Not as bad, but still, you have to get rid of this. So one of the main goals of the urinary system is to take this urea and get it out of you. All right, just by digesting proteins in your food, you are making a nitrogenous waste that must leave. So if you're at rest right now, about a quarter, or at least a fifth, maybe a quarter of the blood leaving your left ventricle are going to your kidneys. And in your kidneys, you filter your blood to get that out. Okay. Now there's a whole much more that happens in the kidneys. There are some hormones made. We could talk about how we regulate how much urine we make. But the goal here was just to kind of hit the highlights of a bunch of systems in an hour. So I think that would be a place to wrap up. I'll ask if there are any questions in a second. We just, the series were going well and they were fun. So we just figured, let's do a little anatomy series and then see if anyone's interested in, a little more about the human body. So we did a bunch of systems, and today was the last one, kind of wrapping up a lot of them. Thank you for coming. Thank you at home for coming. Did anybody have any questions? Yep.
So what does the appendix do?
So what does the appendix do was the question. So this is, I'm going to try to be very delicate in answering this, and if I'm rushing and I'm not delicate enough, I apologize. Okay. Are firefighters important? Of course they are. Okay. Are soldiers important? Of course they are. So like their efforts are valued. If firefighters go to fight a fire and one inhales a lot of smoke and has to take 2 weeks off of the job, does the fire department break down? No. Because it was structured in a way that you understand if a firefighter has to miss a little time from time to time, that doesn't cause the thing to collapse. Same thing with a soldier, getting wounded. We have immune cells everywhere. So none of them are useless. Your appendix is full of immune cells, and it's helping to monitor the microbes of your gut. But you have like so many of them, your lymphocytes alone equal the weight of your brain, all right? You've got immune cells everywhere. So like if you had your appendix out, would you choose to do that? No. All right, but if you had to, what would you notice? Yeah, nothing. You got so many more, you're fine. Same thing with your tonsils, and things like that. So that would be. Any other questions? Have a wonderful evening. Dorothy, did you have anything you wanted to say about series?
Starting next week already, the series on local birds that was so popular last fall that Walter is going to grace us again with more details on perhaps the same but also different.
Yeah. It'll be in room 128. Now that classes come in session, these lecture rooms are a little higher demand. So 128, which is if you were to walk out here, make a left. And we'll have these posted. There's a Zoom link here. But once again, if anyone wanted to either email Dorothy or... Okay.
We'll have that made in posters, but we'll also have it digitally if you're interested.
Or, Walter Janet, SUNYorange.edu, I'd be happy to send you a Zoom link. Thank you so very much for coming. Have a one. Oh, actually, you know what? If someone in the chat is going to say, could you put it in the chat? I think someone said that before. So I'm not sure that's what you're saying. Okay, thank you for okay. But I'm not good at this yet. I'm like, yeah, of course I could put it in the chat. There you go. So it's in the chat if that helps you. Good night, everybody. Thank you. And if you have any remaining summer, I have a week. I hope you enjoy the remains of your summer. Thank you, Rhoda. Good night, everybody. And forgive me, you do a lot with mushrooms, don't you?
Trust it.
Try to. Yeah, no. When we were saying, I was answering the question, but I was thinking like, I'm the wrong person to be answering this. You should have been fielding that.